today we'll be having small two discussions. One will be on the base of skull, what all questions can be expected from this section, and secondly we'll be revising the second important bone after mandible, that will be your maxilla. Okay, so I'll be taking your around 20 plus 20, 40 minutes max, and we'll be covering both of them and revise 2-3 previous OSCEs which have also been asked, and what all can be expected in future from this section. Okay, so guys, from here, one thing from my side, that there will be few topics which I'll be mentioning you to please learn it at any cost. So base of skull is one of that section. This table you have to ratify at all cost. Please, we have been seeing it from our MBBS days, but please remember it. And this is the simplified version, good quality picture from Kenham. You can see all the foramens over here, and there is no fun in saying that this you have to remember by heart. इसको याद करना है, all the foramens, and what all passes through it. It is a must know question. Okay, I'll not say that you should. It's a must know question for you. Okay, so let's see what all we have to study over here. Let's come to the first question. I'll enlarge the image for you. Okay, what is the highlighted structure? What structures pass through it? And what is Wernicke syndrome? These three questions are being asked from us. So can somebody unmute and just answer the first part? Okay, what is this highlighted structure? Anyone? Chalo, I'll answer. Okay. The answer for this is jugular foramen. Okay, so please remember it. Jugular foramen remains one of the most important section from where you will be asked question. And let me tell you, you will get one question or the other from base of skull, whether it's from hard bone anatomy or a CT or a section from somewhere. Definitely you are gonna get one OSCE definitely from this place. Okay, so it is important. Okay, so let's, what Scott Brown tells us, that this jugular foramen is divided into two parts. Okay, first is your pars nervosa, and what is the second part? Pars vascularis. Okay, what is the second part? This is pars vascularis. Okay, no messages. Take. So this pars nervosa, since it is nervous, what happens over here? It's a small as compared to the second one, and it has two things: ninth cranial nerve and inferior retrosal sinus. And what passes through pars vascularis? 10, 11, jugular valve. So you can remember in this way that vascularis is a bigger word as compared to nervosa, and we have three structures, three things passing from here. So iski wajah se this gets nervous ho gaya, and it becomes small. Okay, so this way you can remember. So remember the three structures which are passing from here. Now we have identified what is this thing, what is the division like, what structures pass through it, and what is Wernicke syndrome. Okay, so we'll be seeing about what are the syndromes associated with jugular foramen subsequently. Okay, so they will answer this. Now this is again an important CT section where you can be, any of these can be masked as X, Y, Z, and you might be asked ki here please identify. I'll just share. Okay, you identify what is X and what structure pass through X. Okay, so this section, please, it's important. Please don't miss this section. This is the traditional anatomy day section which we have been seeing from long days. This section, if you remember it, it's well and good, because if it comes in exam and they identify ki inko pehchanna hai na? What are these nerves? So it becomes a problematic thing if we just try to recall in our exam days. So that's why I have placed it along with the CT section, that this is important. Please revise it. Okay. So let's see what else we are seeing. Okay, so here we get all the names of the syndrome. This table is from Scott Brown only. So hence, without saying that, it is very important for you. The first syndrome is Collett-Seekert that they have given to us. Second is Wernicke, and third is your Villaret syndrome. Okay, so what happens, what they were asking in the previous question was that what is Wernicke syndrome? This is basically the palsy of your 9th, 10th and 11th cranial nerve. Okay. Okay. What is the second question they might ask? What is Villaret syndrome and what is Collett-Seekert syndrome? So please remember these 3 points: Wernicke, Villaret and Collett-Seekert, specifically with your jugular foramen. And apart from that, the other questions can also be a part of your question. So it's advisable, since you have ample amount of time with you for study as of now, you can learn these the other syndromes also. Any of them can be a question for you, OSCE. Okay, this is again an image from Scott Brown, okay, from the jugular foramen section. Please, they have already given the details. Okay, so they might ask you similar kind, identify what is example, what is 2, okay, what is 3, what are the structures passing from structure number 3, name one, like suppose jugular foramen यहाँ पे 6 number है ना, they might ask you identify this, what all structures pass through it. So it is an important section. They might ask you in either hard bone anatomy or in a CT scan section. Both of them are important. Please remember it. That's all that you have to study from jugular foramen. Okay, so let's go to the second important thing of your skull base, that is your superior orbital fissure. Though we tend to overlook this section, but believe me, this is important. Okay, I'll show you with the laser. See, they might ask you, they will mask it. What is X? What is Y? What is Z? Ovale, spinosum, carotid canal. Both in hard bone anatomy and in CT anatomy, it is important. Okay, so what they are asking over here is, what are the boundaries of superior orbital fissure and what is Rochon-Duvignaud syndrome? 2 names come in front of you. Okay, so let us see what are the boundaries of superior orbital fissure. They are mentioned over here. The medial being the sphenoid, superior being the lesser wing of sphenoid, inferior again greater wing of sphenoid, and lateral being the frontal bone. We all remember them, but since all of these things tend to be confusing, that's why we tend to forget. So please write them once, okay, and just remember this thing. This is important and it can be a potential OSCE. Same comes for this. What are the contents from superior orbital fissure? We remember them. Obviously, we have been studying them since so long. But exam ke hisab se, how to write about it? We have to write in point-wise format. It's not a theory exam anymore. They will give you, suppose example, 2 marks for what are the contents. So you have to write it, mention it point-wise. Tuck, tuck, tuck. These are the contents which are passing. In order to gain good marks. If you will write paragraph-wise in your OSCEs, so the marks will be less. So therefore, now practice how to answer point-wise. Whatever they are asking, just answer that thing. Okay. So boundaries ho gaya, contents ho gaya. Let's see over here again a similar kind of image that we saw previously. It's also important. Now here, let us see, enlarge this image. Superior orbital fissure syndrome is also known as Rochon-Duvignaud syndrome. Please remember it. It is important. Okay. And now what happens in superior orbital fissure syndrome? This. Okay. So because of inflammation, because this is also a question. What is Tolosa-Hunt syndrome? Okay. So this is a inflammatory lesion involving the superior orbital fissure, and these are the other reasons. And how it will present? It will present to you as ophthalmoplegia, okay, ptosis, exophthalmos. Now, fourth point is important. Why is it important? That blindness or decreased vision to the optic nerve results in orbital apex syndrome. Why? They'll ask you this thing. Second part. What is the difference between superior orbital fissure syndrome and orbital apex syndrome? This is the difference that you have to remember. Where is my red color? Yes. That this is normal vision, whereas in orbital apex syndrome, there is vision loss. Okay, so please remember this thing. Rest of all things remain same between the superior orbital fissure and the orbital apex. Both of them are a potential OSCE question, so they should be revised multiple number of times before your exam. Okay, let's see what we have over here. Okay, now here is again a question for you. This is an important section actually. Okay, so they might ask you what is A, B, C, D, E, F. Okay, so I'll answer it because I've already seen it from the Radiopedia. What is the answer? I'm presenting it in front of you because it's an important section. This might be asked from you. Okay, so A is your pterygomaxillary fissure. B is your foramen ovale. C is your carotid artery. D is your incus. E is your either facial nerve you can answer, or you can answer it as stylomastoid foramen. Okay, and over here only all your deep neck space infections, just mention a point about them. One of them you will definitely get in your exam. Okay, so we'll be seeing them in details in the subsequent sections, subsequent classes. I just saw this pterygomaxillary fissure. I thought I'll share it with you. This is important. Okay, so these three things you have to remember for the previous one. So one important thing is about the deep neck space infection. Second thing that you have to see, these are the must know topics. Okay, this is your skull base osteomyelitis. Skull base osteomyelitis. Then this will be your vestibular schwannoma. And fourth will be your NF2. Okay? These are must know topics. Like in previous class, we saw few topics which are must know from the otology section. You will be getting OSCE and viva questions. What all questions we are getting, that will be seeing subsequently. So this will break down all the topics, but these are the things. Okay, and from next week onwards, when you people start putting thrust in your studies, let me know. Okay, so during the non-session days, like supposedly we have like these sessions for 2 days a week, so remaining jo 4 days bach rahe except the Sundays. Okay, in the evening around 9 o'clock, the OSCEs that we read every day at 9 o'clock, that we will decide a day prior. Like example, we'll decide ki theek hai, kal skull base osteomyelitis we'll revise. So you have an entire 24 to 48 hours to revise skull base osteomyelitis. Revise it once, and around 9 o'clock, keep your mobile in your hand and just participate. What all OSCEs, what all questions can come from that section, I'll share it in a phased way around from 9 o'clock till 9:10, 9:15, and along with the answers we can discuss on WhatsApp itself. And how it will help you? It will help you to reorganize your thoughts. Okay, it's not that कि आपने skull base osteomyelitis पढ़ा नहीं है. You would have read it multiple number of times for your theory purpose. But what all OSCEs can be expected from that point, that we will see from these type of sessions. Okay, so this I'm planning from next week. Okay, so these are the answers for the previous thing which we saw. Now coming to the second bone, that is the maxilla. Okay, so guys, यहाँ पे what you have to study is I'll take you through the OSCEs and the questions that are expected of you as an ENT surgeon. But a few of you who would be interested in the hard bone anatomy, like what are the surfaces, what are the processes, borders, वो वाला section है. So I'll share a link of video from Dr. Virendra Kadian. Around 45 minutes video. Please, those who all are interested in that, please have a look. It is knowledgeable, but only thing is it's boring. है ना, 10 minutes ऊपर पढ़ा नहीं जाता है. So I'll take you to the questions that will be asked from you from this maxilla section. Okay. So guys, again, requesting 15 minutes of your attention, please. Okay. So let's see. So the first thing they will ask you is, what is the classification of maxillectomy or maxillary defect? So two names you have to remember: Cordroy and Brown. Okay, Cordroy and Brown. How you can remember it? It's like Max, like In Max Hospital, you do BC. Okay, so B is for Brown's classification, C is for Cordero classification. Now, can somebody unmute here and tell me what were the classification used for the mandibular defect? Last class ka hai? Just name I'm asking, no details. डालो दिमाग में, तू डालो, कुछ आ रहा है याद? Sometimes I feel आप सब लोग लगा करके Google Meet पे you would have gone.
So what is the question? Can you repeat?
Yeah, like we have these classification for maxillectomy defect. Mandibular के लिए there were two known classification. Anybody remembers the name?
Arkan and SCL.
Arkan and SCL. Yeah, thank you, Dr. Sir. Thank you, Dr. Sir. Thank you so much. Okay, so I request thoda sa participation. That's all. Like in case possible. I also know being on the other side, it's I also used to do the same only, but request for it. Mandible के लिए remember it's a revision thing. ठीक है, साथ साथ रिवाइज करते चलो. ठीक है. After this, any of you who would not be remembering what were the images that were there, because वहाँ पे आपको they might give you the image exactly and they might ask you what is the classification over here. Okay, so these are the two classifications that you should know for the maxillectomy. Coming over here, the second question that they will ask you is what are the reconstruction options that are available to you for maxillectomy, defect of maxillectomy. Okay, so similarly, free fibula graft, we remember ये mandible में भी था, that OSCE we practiced, that's important. Apart from that, you can answer this rectus abdominis flap, radial forearm flap, and anything. But at least two you should remember. This is an important thing. Okay, important section. We'll see the question which has come from maxillectomy at the end of this session. Remember it. Okay. Now, what is this? Can somebody try and answer? This is how obturator. Okay. During the maxillectomy and all, we tend to create a palatal defect. So in order to cover the defect, this kind of prosthesis is given by the dental people. They take a measurement prior to surgery, like what will be the size of this prosthesis, and after surgery they apply this obturator so that the defect gets covered. So that this defect gets covered. Okay. So after doing the classification of defects, reconstruction option, and the obturator, let's come to the types of maxillectomy. It is very important. Only two things you have to remember. One is medial maxillectomy and one is total maxillectomy. Second things that you have to remember is the steps. The cuts in osteotomy basically. Okay. What all cuts you will place in medial of maxillectomy and what all cuts you will do in total maxillectomy. Okay, it is important. Not only in maxillectomy, the same thing will be important when we'll read about rhinoplasty. Okay, what all cuts will be there. Okay, so let's see over here. What is medial maxillectomy? This is basically resection of the medial and the supromedial walls of the maxillary antrum. Okay, and we will read about the modification also, that is the Denkers, how we go about it. That's okay. Okay, so as of now, for the initial purpose, remember, this is how we remove it. Okay. This is another method, infrastructure and suprastructure. Okay. What is the difference? They might ask you what is the difference between infrastructure and suprastructure maxillectomy. This is the orbital floor is kept intact. Okay. This is important. Now, what are the cuts in medial maxillectomy? This is as per the article that I have shared with you in the group. Okay, details are given over there only. That's around 10-15 pages article. Please go through it, those who are interested. But otherwise, isko yaad kar lena. What are the cuts that we go over here? Okay? This is the cuts through the, like it gets boring if you go through it. Ye kaatenge. Remember it. Just placing it in a right format gets the thing going, okay, and it is important. Go through it, please. Okay. Now, the elder brother of medial maxillectomy is total maxillectomy. Okay, so what is this total maxillectomy? This is like resection of the entire maxilla. Okay, and what all it includes? It includes the floor and the medial wall of the orbit and ethmoid sinus, the entire floor and medial wall that you remove, and apart from that, orbital exentration and synodectomy and removal of pterygoid plate, depending upon the involvement of the lesion, that can be done. Okay. Second question they might ask you is, what is the complication of this surgery? So here it's given that it's like we'll answer it by common sense also. Okay, that we'll have the injury to orbital contents like rhymal drainage, optic nerve and all, and apart from that, bleeding risk is there. So please remember this thing. Now, second part of total maxillectomy that you have to remember is this, that what are the cuts for total maxillectomy. Okay, these are the cuts that you should remember for total maxillectomy. Okay, in diagrammatic version, if you want to go through it, this is the way you go for total maxillectomy. Okay, this is also you should remember. This has been asked once. Potential question for repetition. Okay, now coming to the third thing, what are the branches of maxillary artery? Okay, so branches of maxillary artery, basically they are divided into three parts. They are divided into three parts. How you can remember it? They might ask you what are the branches of maxillary artery. This can be a potential viva question also. And apart from that, OSCE maybe they might ask you what are three things. Okay, so the first part, there are four branches. First is middle meningeal artery. Second is your accessory meningeal artery. Third is your inferior alveolar artery. And fourth is your deep auricular artery. Okay, this you can remember by mnemonic of MAID, M-A-I-D. Okay, M is for middle meningeal artery, A is for accessory meningeal artery, I is for inferior alveolar artery, and D is for deep alveolar artery, deep auricular artery. Apart from that, एक extra होता है इसमें. This is anterior tympanic artery. Okay. Second, what you tell maid? Maid को हमने क्या बोला? Maid को बोला कि please make some dinner before party. What we told her? Make dinner before party. What is this? M stands for mesenteric artery. D stands for deep temporal artery. B stands for buccal artery. And P stands for pterygoid artery. Okay. Third thing, there are three things that you have to remember. First is P, I, G. P is for postero-superior alveolar artery. Okay. I is for inferior orbital artery. I know it's boring, but just give me 2 minutes, it will finish. And G is for greater palatine. Then sphenopalatine artery. Okay, so this is like Peppa Pig pass हो गया, P-A-S. Just for remembrance, Peppa Pig pass हो गया. Okay, so this mnemonic was given to us by one of our seniors who is presently doing his MCH in RCS Trivandrum, dedicated to him. Now come to this question. A 65-year-old male presented with left maxillary swelling, blood-stained discharge, orbital proptosis, and diplopia. He underwent some surgery. Following is the resected specimen. Identify the surgery done. Can somebody try and take this first answer? What is the surgery that is being performed?
Medial maxillectomy. Total maxillectomy.
I'll go with total maxillectomy. Why total maxillectomy? Because the history which they are giving to us is like going more towards the malignancy part. Okay, so medial maxillectomy would not be a better option as per myself. अगर मैं exam दे रहा होता तो I'll answer it as total maxillectomy with orbital exenteration. ठीक है. अच्छा. Name any two recon option that is available for this patient. We already saw it previously. Okay. DCIA flap, rectus flap, free fibula flap, radial flap. But we saw it. Okay. Now comes the third and important question. Enumerate the osteotomies required to perform this operation. Now you see why. What is the difference? ये एक number था, ये एक number था. इसके लिए आपको they are giving you 2 marks because you have to write in a flow chart. Na 6 names you have to remember from where you are cutting it and like that you have to write in a sequential way. Then coming to this, that what is the investigation of choice for the orbital extension? You can write CMRI. Okay. Now. Okay, I think this will be the last. No? Okay. The article which I have shared with you that contains all the details. Like ये तो हम लोगों ने we have seen it. What are the questions that you are supposed to know? For people interested to know in depth about it, please go through that article on maxillectomy that I have shared. That contains all the details. उसके अलावा you will not have to study anything else apart from that. One second thing is that same article only it contains I'll just share it on group only for you guys. There is an image for this. A minute, please. Okay. This is the image for maxillary artery. Okay. Schematic image. Okay. So please go through this image also because they might also ask you. इसके ऊपर है ये branches के ऊपर है. ठीक है. Branches के ऊपर question है. They might ask you. Remember it. Okay, now coming to this slide, last one. Again, this is an important slide related somehow to maxilla. I found it in the same article itself. That's why I included it over here. Okay, guys, here you have to remember about 3 things. Just a minute, please. Okay. First is your. They'll ask you what is this over here, first question, and second is Kennedy's nipple. Okay. These are the 2 questions that they might ask you from this place. Okay, so I've tried to keep it short only because of the specific things that we were discussing today. Okay, along in the skull, base of skull, what extra things that you have to remember, I'll just mention it over here. That is your vestibular schwannoma, only from Scott Brown, nothing else. Okay. Then apart from this vestibular schwannoma, neurofibromatosis part 2. Okay. Then we'll be seeing the SRS and SRT part. That is your stereotactic radiosurgery and radiotherapy part. What questions can come from this? And fourth will be skull base osteomyelitis. That also will revise in this form only, questions form. Okay, so for the next week, we have the first case in viva for thyroid. If somebody is interested in, like last time, how we had gone through it was that in the initial half, I had only gone about how the case will be presented, what all questions will be expected. In the second time, when we revised the thing, we introduced this for the candidates. So if someone of you wants to go for that thyroid case presentation, just drop me a message Okay, and I'll let you know. Prepare it. We have 3-4 days. So either on Monday or on Tuesday, I'll let you know. I'm just trying to exchange my duty. If it gets possible, so we'll have it scheduled on Tuesday itself. And अगर Tuesday का duty schedule नहीं हो पाता है, तो we'll have it this class on Monday only. ठीक है? Case and viva on thyroid. So please read about thyroid. Okay, from your notes. Okay, from Scott Brown, and what all expected questions are there from thyroid. Both for case taking and for OSCEs, that we'll discuss it along. Okay, so next week we'll dedicate to the thyroid only, so that we'll finish thyroid once and for all. And जब एक बार result आ जाएगा, we'll again have the second session going. So you all will be automatically added to that section. तो आपका revision इसमें हो जाएगा. Okay. So any point from your side, Dr. Sam? Okay, so if anything else is there, please drop me a message. Okay, you can anytime drop me a message, and we'll increase the questions and slowly and steadily, just taking the tempo along with all of you guys. Chalo, take care, है ना? Okay, bye, good night. We'll be sharing the PDF soon. Okay, bye.